Good afternoon, everybody. This is Aimee, St.Arnaud. I'm with Best Friends Animal Society, and I've got a great panel here with you today. I'm going to let them all introduce themselves. So let's start with Dr. Berliner. If you could introduce yourself.
Hi, I'm Elizabeth Berliner. I'm the director of Maddie's Shelter Medicine program at Cornell University.
And Cynthia Karsten, if you could introduce yourself.
Hey, everybody. I'm the outreach veterinarian with the UC Davis Cret Shelter Medicine program.
And Gina.
Hi, everyone. Good afternoon. I'm Gina Clemmer, the director and founder of Clinic HQ.
And Dr. Levy.
Hi, Julie Levy from Maddie's Shelter Medicine program at the University of Florida. And I'll be watching your chat and also taking your questions at the end. So if you have questions, please be typing them in the chat as we go along.
And Dr. Bolser.
Hi, I'm Jennifer. I'm on the board of directors for the Association of Shelter Veterinarians.
And Natalie.
Hello, I'm Natalie Corwin. I'm president and CEO of Pet Community Center in Nashville, Tennessee.
Great. So we've got a lot to discuss, so we're going to get right into it. There has been a lot of discussion recently on if spay-neuter is essential. And I think we all agree that spay-neuter is essential, and it is and has been an essential service. But much like other services that have been labeled as non-essential during the pandemic that we know are really important. So for instance, hair salons and massages we know are very, very important. So non-essential to me was a little bit of a misrepresentative term because it was about trying to keep clients and our staff and our community safe. And it wasn't about if the service was important or not. So being labeled non-essential didn't diminish the value of spay-neuter or these other services. So what we want to make sure today is that we're all giving each other some support on the individual decisions that we're making because things are changing every day. We're all just trying to do what's best in times of great uncertainty. And so for those clinics, if you stayed open, if you are still closed and need to stay closed, or those who are really starting to think about offering services again, now is a time that we really want to try to focus on how do we come up with ideas for doing spay-neuter safely within this new norm that we're faced with? Because this is going to go on for a while. So we're not going to be able to just jump back right into the way we were doing it because we have done so great at developing high volume spay-neuter, but we're not going to be able to just go into full capacity right now the way we were. So we're going to need to make some adjustments on how we do spay-neuter. And that's really what today is about. So the group that you just met, that we introduced, is the panel that came together. We had all been talking about this individually. And so we all started talking about this, and we brought together a group of reviewers as well that represent all sorts of different clinics. So MASH and community cats, stationary clinics, shelter, wellness clinics, so that we'd have a really diverse group of people who looked at a guide that we put together. So our goal was to put together a guide that would help you with your plan. So it's not about making it a requirement or a hard and fast rule that you need to do, but ideas to help you in your planning as you figure out what's right for your organization and your community. And we also are welcoming you to submit samples. If you have something that is working really well, we're going to give you it. It's going to be a living document, and you'll see in the chat where it is located at, and we'll keep you updated. It's going to be updated as things change because we know that's going to happen. So what we're going to do right now is I'm going to facilitate some discussion with the panel about the guide and what's in it and what we've put together. And then we're going to open it up for Q&A with all of you because we really want to hear what you're doing. So please share things that you're doing in the chat, ask questions of things you want to know. And we're really going to try to make this a conversation because we're all in this together. And then Dr. Levy will be monitoring the chat and she'll ask the questions live at the end. So I'm going to jump right in so that we have enough time to get to this. So I'm going to start with really thinking about the physical building. A lot of us have very small clinics, so you're obviously in a small space already, and that can be a challenge. So Dr. Berliner, many clinics have these small spaces, people close together, doing high numbers of surgeries. What are some things that clinics can think about in their physical space to be safe while delivering these services?
Thanks, Aimee. And I'll preface this with the idea, I love small spaces for high volume spay-neuter during normal circumstances. When I'm given a giant gymnasium, I still tend to smush people together, and anybody who's worked with me knows that. And so I think it's a tremendous challenge to look at the facility that we're working in and figure out how to do this more safely with our teams. And so when I think about how to decrease the risk of disease transmission in these settings, I think about a model for kind of affecting things at an engineering level. So what can I physically do in that space to set myself up to be in a better situation? And then I think about kind of administrative controls. How do we function differently? And then I think about PPE, which is kind of the bottom of that triangle. And this is something from the CDC. And so in looking at the physical capacity of clinics, I started thinking, okay, with the tiny space I work in, because I work in a small clinic, how many people do I think I can safely put in that space? And as a shelter veterinarian, I'm used to thinking this way when I think about cats, right? Like we have all kinds of guidelines for the capacity for care for cats in a space. And so I had no trouble picturing myself as a cat and thinking, how many people can I put in this space safely? As a ballpark, we came up with a 60 square foot minimum per person, and that's a ballpark. Obviously, people aren't going to stand in one space the entire time, but that's a ballpark for thinking about having a 6 foot radius for at least 180 degrees around you so that there's some space. We looked at some industry guidelines from other industries where they are suggesting that workstations and desks are moved 6 feet apart. So obviously there are limitations to what we can do with our workstations in our clinics. Mine are attached to the floor, but it helps me to think about, is there a way to move some of our functions further apart to create some kind of stability through the day, even as we move in that space? Obviously, there are many elements of what we do that are going to require us to work together in close proximity and not be able to maintain those 6 foot or even 3 foot sort of distances. And so that's when kind of the administrative piece, the PPE piece, the other things we'll talk about come into play. People have gotten really creative with engineering here. So things like plexiglass between some workstations, making tape marks on the floor just so people kind of have a visual cue, your staff to kind of think about their distancing. And then depending on the clinic that you're in, a lot of our programs work in a shelter. There may be some spaces that you can use that you don't normally use as part of spay neuter or surgery, particularly because the inventory of animals in shelters is fairly low right now in a lot of places. I think there's a way to look at whether you can repurpose or use differently some of the spaces that you have. And so that's a few of the examples that we came up with thinking about physical capacity. But I think it's fair to say that we're going to need to have fewer people than we normally have in those spaces. And we're going to have to work on a different sort of efficiency in order to stay safe. A lot of people in the past have tended to make us more efficient as we assign jobs. And I think we're going to have to think about doing that differently.
Thank you. And I think along with the physical capacity is kind of the staffing capacity. How are we going to fit people into these spaces and keep them safe? So Dr. Bolser, so how can we think about how to best handle our staffing levels and our scheduling? Could you talk a little bit about some ideas there?
Sure, and this definitely ties into what Dr. Berliner was talking about with physical capacity. So that's going to be an important aspect for some organizations around, okay, how much staff can we actually support and provide a safe space for based off our physical capacity. But in addition for staff capacity, we really need to do a good self-assessment of that staff. And so we have examples in there of some confidential self-assessment for an individual to look at their own health, their own family situation. Are they in a higher risk category potentially? What's their actual physical capacity for working, such as hours per day or days per week and those type of things. So having each organization go through that with their staff members. And when we talk about staff, we're talking about paid employees as well as volunteers. So we definitely want to make sure that we're thinking of everyone involved in our spay neuter operation, whether they're paid or a volunteer. So if I say staff, I'm including both of those groups. So going through an assessment and then talking about it and figuring out, okay, I have staff members that can do, X amount of days, or I have staff members that I'm more concerned about their potential disease risk, and we may need to shift their role a little bit. We may need to think about how they work in our organization in a different function. So kind of identifying the potential challenges and opportunities in the staff is really important. There are other examples that, with certain organizations that have a larger staff, they've been able to split into teams. So a team A, team B, and maybe even a reserve team. And that's been really effective to help keep groups of people isolated from others, so that if there was a potential exposure, then we're not having the entire organization have to shut down for one exposure. So that's proved very effective for some groups if you have a large enough staff capacity. So we give examples with that, as well as examples of like cleaning protocols between the different teams, so that you can transition between one team to the next in a clean space again. But other groups that I work with, as an example, there's only maybe 2 or 3 staff members, so that there isn't going to be a split team option for them. But they may look at, okay, let's try to reduce the physical time we're together on each day. So we may now be looking at working shorter days and maybe more days to try to decrease that sort of time relationship that's really important when we're talking about human contact. So a lot of this is going to depend on the particular situation of the staff in that organization and the different options that they have.
Great, thank you. So, Dr. Karsten, since many clinics may not be running at full capacity for a while, but they're going to have very high demand, that pent-up demand and need, and what are some things to consider about prioritizing patients and how to handle that aspect?
Well, in addition to everything that Dr. Berliner and Dr. Bolser have said in terms of our physical capacity and staffing capacity to keep everyone safe, the staff, the patient, and the clients, who we choose to do surgery on, which patients we will prioritize, also becomes really, really important, because depending on who we choose, we have different interactions within the clinic. And we have to think about it not just in terms of at the time of surgery, but also how much staff will be needed in dealing with any aftercare. So I'm thinking, for example, potentially prioritizing animals that are at risk of pregnancy, because we need to mitigate the medical care needs to potential offspring, which could then mean additional and quite possibly longer duration of contact among staff if that happens. So thinking a little bit more holistically, and then also recognizing that right now, the increased stress that we each have of keeping ourselves safe and the effect of our everyday actions, it takes a lot of physical and mental energy for us to manage all of that. And so we need to be conscious of that and how it affects our ability to make good decisions. So again, as an example, dogs, larger dogs, especially ones that are not as cooperative or maybe a little more aggressive, because this will take more of our energy. It will likely take more people and quick decision making. So just recognizing in our patient selection the fatigue that can come with different patients, and using that in our ability to prioritize. And then really thinking about this being a time of focusing on the individual animal and the effect of the surgery on that animal and the relationship to their person. Since many times this is the way that the surgeries that we choose to do can have the biggest impact. So thinking of in terms of a housing insecurity that might be happening because of an intact animal, or nuisance from TNR animals, and just really trying to weigh all those factors in as we choose which patients to do, when likely we're at a time when we just can't do them all.
So I want to open up before we move on to the next section, kind of scheduling. If any other panelists had anything they wanted to add on any of those topics about physical or staff or prioritizing patients. We covered it all?
I think if I can add one thing, Aimee, one of the things we really struggled with in thinking about this is that a lot of our programs are used to using quite a few volunteers in order to potentially recover patients or help with check-in and communication and all those sorts of things. And we really need to think of our volunteers. We always think of them as part of our teams, truly, but we need to think of them in terms of all of these risks as well. And people will sometimes put themselves at risk for animals, I have done it myself many times, but we've really got to be conscientious in watching out for each other, I think, and that includes our volunteers who may be in higher risk categories and potentially may not have had all the same degree of training as our staff has had if we've been working with them for long term.
Okay, so Gina, let's talk about scheduling. So you have hundreds of clinics that use your software, Clinic HQ. It's kind of the Spay Neuter software. So you have a good idea of how many clinics are handling scheduling with the new social distancing guidelines. Can you share some ideas that we talked about and put in the guidelines?
Yeah, sure. I'd love to. Thank you. So really, my observations revolve around two primary points. The first one is pre-prepping appointments. So it really starts when we think about expediting check-in, starts with appointment scheduling. So first up, if you're a clinic that's not really used to taking appointments, so maybe mobile clinics or mass units, the first thing is to begin taking appointments is very helpful. So in that process, of course, you can collect information about the client, simply just things, the client's first name, last name, their home address, their email address, and some complex pieces of information that you can collect ahead of time instead of maybe relying on the old way, which was perhaps like a tri-part form that they sort of fill out. So the first recommendation is to take appointments. The second is to collect all those things that normally they might be filling out on an admin form, sometimes called like a consent form or surgical release form, to take that information and to then drop it into that admin form using merge fields. So what that means is using like Clinic HQ or like even Microsoft Word has merge fields built into it, so you can pre-populate those fields. And what that gets you is then clients don't have to sort of standing around a parking lot or the lobby filling out what your normal paperwork is, because 80 to 90% of that form will already be filled out with information that you've collected at the appointment. Another complex piece of information that can be pre-prepped or pre-collected is service selection. So what is appropriate for that patient? So it is helpful to begin those conversations while making the appointment. So you can pre-prep those services and input and set up what that patient is supposed to be getting instead of doing that the morning of check-in, which many clinics would typically do. So instead of sort of chatting with the client about that. So merge fields, pre-prepping services, and then another piece out of the four complex pieces of information for check-in. So another piece then is to get the client to pre-sign their document. So to pre-sign the surgical release form. So you can use HQ to do that. You can use like DocuForm. HelloSign is another one to pre-send out that document and get it signed before they actually get to the clinic in the morning. And the fourth piece, of course, is prepayment. So lots of clinics have lots of different ways to pre-take those payments. So now is a good time to start utilizing some of those tools. So the first recommendation is pre-prepping every single thing that you can possibly do before the client and patient actually get to your parking lot in the morning. Even down to sort of pre-filling out neck collars for dogs, like every single aspect is pre-done and ready to roll as soon as they come into the parking lot. The second recommendation is social distancing at check-in, check-out. So a lot of clinics now have moved to a model of either curbside check-in or sort of forming lines with X's 6 feet apart. Those are really kind of the two options that are happening right now. My personal recommendation, what I believe to be the safest, is to have owners and animals stay in their vehicle when they come into the parking lot, and really to use the car as a container to enforce social distancing. So if we think about it, if they've done all the things that we've talked about, so you have their admin forms pre-printed with the merge fields already filled out, they've already pre-signed, prepaid, and pre-selected services, really all you're going to have to do is to ask just confirmation of services. So, you know, they of course, you know, should have the option to change those services. So confirmation of the services, and then if they didn't have email and they couldn't pre-sign the form, they may need to pre-sign the form with maybe just handing a disposable pen over, and they sign and just give the form back, and they keep the pen. So sort of curbside or parking lot check-in, I believe to be the safest. But some clinics, I mean, don't even have a parking lot. So they have to then move to a different model of kind of forming a line. I am not a scientist, but some things kind of coming out are saying that 6 feet is not enough space in between those X's necessarily. We just saw an article yesterday for Winston, the pug who contracted COVID from his family, presumably. So dogs being kind of nose to nose, I do not think is the safest recommendation. So each clinic has to kind of investigate that sort of for themselves. But and then for checkout, same sort of thing. That the paperwork, all that stuff can be emailed to clients ahead of time or texted to clients, and really you're just handing over the animal back to the owner at checkout. These tools are available through lots of different kinds of applications that you can sort of piece together. We're offering at Clinic HQ a COVID special, so 3 free months if you're interested in just using it just to get you through this gap period. Go to our website, check it out, email us, and that'll get you that. So thank you.
And I think too, with some of the checkout piece, one of the things, because a lot of clinics that are dealing with underserved populations do have people who have maybe data concerns, so they might not be able, so you always want to check first to make sure that they do have data plans that can allow you to text, or see if they can email. A lot of clinics are also doing videos that they've either made themselves or that they're using from ASPCA Pro has a good sample one that you can use. It's a generic one. So there's a really lot of great ideas, and we really tried to put specific samples in this guide so that you can actually kind of look at these and see how other clinics are doing it. But I'd love also to hear Natalie's input on this, because you actually run a clinic in Tennessee. So you are a director there. So you're having to make these decisions right now because you're just getting ready to open soon. So why don't you talk a little bit about your intake and release process?
Yes, so it's a work in progress for sure. We do use a mobile waiting app called WaitlistMe. It's a restaurant app, and there's other apps out there too that you're able to use. A lot of them have free versions, so you don't have to pay for them, which can kind of help you automate your process. You can even do like an old-fashioned like number system where you have a whiteboard and you can write the number on the whiteboard, like who's next. So you can kind of communicate to people while they're still in their cars. So the idea is to kind of, again, keep that social distance as far apart as you possibly can. One other thing, I noticed that Dr. Hurley asked in the chat about pre-screening clients when they call in to make their appointment to see if they have had any COVID-19 in their household, and kind of getting an idea of that ahead of time. So you may want to delay those appointments until after the people in the household have recovered. So that's another thing to kind of think about as you're taking appointments. We are, in our clinic, we are doing a curbside check-in, no clients in the building, try to take payment over the phone, or we actually are a Clinic HQ client, and we're in the process of converting to being able to take payments through Clinic HQ. So we're all just kind of flying the plane while building the plane. We are closed right now, but still kind of figuring all of that stuff out as well.
And the guide does have some suggested questions to ask clients. So there are questions in there that you can kind of take and use to ask their exposure. And I think the other thing we're seeing is a lot of people doing contactless check-in. So for instance, not everybody feels comfortable or can't do curbside check-in. So some are still allowing people to come into their building, but they're allowing like 1 person per pet, or they're allowing 2 people at a time. In Ohio, where I'm from, our governor said, only allow 50% in of what your normal fire capacity would be. So you can look at different ways, but what they're doing is with their rescue partners or their TNR partners is they're actually setting up like empty carriers in there, or setting up a space for traps, and people can come right into, if there's a vestibule or a lobby, they come in, they drop those animals off. You could set up a Ring camera or a system for notifying when the person has come and gone and filled out the paperwork and left it there. So then your staff can go and get those animals safely. So there are ways to do that as well within the building without having our normal long lines all in there like we normally do.
Just one other thing, there have been several questions about like, what if we can't go paperless, or if we have TNR, feral cats and traps, and you don't know what those are going to be ahead of time. So if you do have to use paper, there are some recommendations included in the guide for dealing with that. We recognize that not in 100% of cases will you always be able to go paperless. So definitely that is a consideration.
Yeah, and I think
I would also add, sorry, Aimee, I was just going to also add one other point that's in the guide that I forgot to mention, which is taking out, like for TNR or for cats, taking out any personal items, so any blankets or anything out of the cages and the traps and stuff. So that was one thing that we forgot to mention previously.
Yeah, and I think the nice thing here is if you're really tech savvy, there's some great new things coming out of this that we might be able to do virtually and ahead of time. But if you're not there yet and you're still on a paper system and that still works for you and what you're using, or you don't have strong Wi-Fi in the areas you're in, there still are ways to do this with paper. So there's definitely recommendations across the board for whatever type of thing you're working with. So does anybody else on the panel have anything they want to add in terms of intake or release?
There was a question that came through the chat about establishing a VCPR if you're not able to talk to the client. So I just thought I would address that right now as part of the intake process. I think that in many ways, establishing a VCPR is around establishing your assessment of that animal and then disclosing and having some sort of communication with the owner about what's happening. And so for a lot of practices, the surgical release form has been, already developed, and there's a lot of the disclosures in there already. And you can think about different ways of presenting that in an email beforehand so they have an opportunity to read it, and then they can respond with questions if there's email capability or texting or whatnot. For other situations where that may not be possible to present that to them in advance, a lot of practices are doing a phone call, when the client shows up. And so to keep the physical distance, if that client has questions, you can certainly call each other while the client's outside in the car and somebody's in the building, or even going to the car to that person outside and maintaining a 6 foot or more distance if possible. So there's a lot of different ways to do it depending on how many questions that particular client might have and the concern around that. But the VCPR can still be established appropriately. And then, when the veterinarian is examining that animal, that is the establishment of the VCPR.
Yeah, and I think we also did for the people who are doing paper too, because there is a concern that it can live on paper for, I think, is it 3 to 5 hours, CB? Yeah, so one clinic is actually doing where they've separated out, they used to have like a trifold, but they've separated out their waiver from the rest of their materials. And so the waiver is the person signs it and they just put it in a bin and don't touch it again and leave it there for an amount of time. And then they are just filling out the rest of their form. So it's never touched by anybody but other than in the clinic. And then they're just being very careful about in the clinic with their staff. So there are definitely a lot of these little workarounds, and we're going to share all these tips and tricks on in this guide and just keep it updated as we learn more and hear what others are doing. And I think one big piece of this that ties into this is how on earth do we communicate this to people, right? So, you start doing all this stuff, but people pull up and they're expecting your normal process, and they get there, it's completely different, and they're frustrated and they're angry. So, we're really recommending there be a person outside to kind of direct this. But Dr. Bolser, let's have you kind of start with, how can clinics let people know in advance of these new processes?
Yeah, and client communication, this is something we talk about in veterinary medicine all the time. Like, we can never communicate enough to our clients about process and various things. So we just need to be very proactive around this. And so first step is to think about all the ways you currently communicate with your clients and make sure that your new protocols, your new FAQs, et cetera, are there on every format that you currently have to communicate, whether it's a website, social media, phone messages, so the voicemail that the client's going to hear when you're not in business, and signage on the building. I think signage on the building is probably one of the ones we don't think a lot about, but that can be a really, really important place. So when people show up, instead of having to physically talk to somebody, there's a clear sign there to indicate, hey, this is what's going to happen. Here's our process, and here's who's coming out, and don't worry, we're not ignoring you, sort of thing. So think about every way that you currently communicate to your clients and make sure to be active and proactive in getting that communication out, but then also think about additional ways. Some communities, it may be helpful to even put something in a community newsletter, or even looking at radio, TV, if that's a way that you feel like you might be able to message to your clients if you feel that's important. So I think just thinking about all the different avenues and developing the signage and clear protocols that you have for the clients so they know what to expect.
Yeah, and I think too, do you want to talk too just a little bit about training staff on this stuff too? And if anybody else can jump in as well, but how are we going to train, especially like when you have MASH clinics and you have a bunch of volunteers and a bunch of people, how are we going to let all of our staff and volunteers know about this as well as our clients? Could somebody jump in on that? Natalie's cat maybe behind
Yeah. Sorry, everybody. Go ahead.
I was just going to say, when we first started using Zoom for meetings, it was a learning curve, I think, for most people. But a lot of, if I can take the comparison to shelters, a lot of shelters are doing volunteer training and volunteer tea time and volunteer happy hour and all these sorts of large group meetings. And universities have taken it to an unbelievable degree. So I do feel like there's ways to get, again, that's technology dependent and not everybody will have access. But I do think in a lot of communities, it's a way to keep engaging your volunteers, engaging your staff, and getting this training done in a way that now seems friendly to people. My mom is an expert at Zoom at this point. And that's kind of shocking given that I don't think she ever anticipated that.
Excellent. Okay, so just for time, so we can make sure we get to all these great questions I'm seeing. So one of the big things I know has come up in questions is concern over shortage of supplies. We've heard this everywhere. So I'd love to have the vets kind of weigh in on shortage of PPE, concern about supply disruption. What advice can you give people in terms of dealing with this, particularly as new guidelines change and now we're hearing face masks for respiratory animals? What's some advice? Anybody wants to jump in?
I'm happy to start. So, you know, at the beginning of COVID, this was one of the biggest concerns and a reason why in many areas we needed to put a temporary hold on spay-neuter and elective procedures, because many of the supplies and anesthetic drugs that we use are also used in human medicine. And there is a much greater need for those supplies and drugs right now for people to be cared for that are COVID positive. So supply shortage and disruptions are likely going to be part of our lives for a while, and it's difficult to predict. And so, you know, being aware of what's happening in your community, again, this goes back to that community assessment. You know, is your community at a place that, you know, the supplies are more stable so that you can open up, that the hospitals aren't asking veterinary clinics to inventory their anesthesia machines and ventilators. I mean, that was something that was happening weeks ago. So just being aware of what's happening in your community, the potential stress and demand that might be on PPE and anesthetic drugs in particular, and then and pay attention to your distributors. So I've, you know, checked the vendor that I use regularly, and ketamine and midazolam and propofol, when I go to actually try to order them, they're all on back order or very limited supply. So that's a good indication to me that for now and probably for a while, it's going to be difficult for me to get some of the common drugs that we've been using in spay-neuter. So we have some ideas about different protocols and different options for anesthesia, and we can talk about that in more detail later. But being aware of your community in particular around the shortage of supplies is really important.
Well, let's roll right into that actually, because anesthesia is a big one. So, you know, not only, so kind of which ones might be going on back order, and what are some alternatives?
So the ones we anticipate are already on back order, Jen referred to, so propofol, ketamine, diazepam, midazolam, hydromorphone is another one. And some of the local anesthetics, which a lot of clinics will use, are at this point in short demand. Spay-neuter clinics have protocols. Some of them already have the pharmaceuticals they need for a couple of months, maybe, once you inventory. But I think we do need to be open to other protocols or suggestions or substitutions in this time period, especially as time passes. And so we did include some combination protocols, some additional pre-meds potentially that we might use. And none of these are radical. They're all things that are used in various clinics. They just may be new for your particular clinic. And so I think the other piece that we wanted to make sure that we covered in the document was that if you're changing protocols, it's really important to also train your staff in what that means in terms of monitoring parameters and what to look for so that everybody's comfortable on some level so that you can maintain patient safety and some degree of staff comfort in what is already a fairly stressful time. And again, this is a living document. We expect to add things to it pretty constantly and are creating a system for that. And so I am sure that there are other things that people will engineer that we want to hear about. We heard about people 3D printing face shields today. So I'm sure there's lots of ideas that are out there in the chat and in the communities that we can integrate into this whole system.
Anybody else on anything about that?
I always just like to stress that for groups that have a good multimodal anesthetic protocol with good, analgesia, provides a good surgical level of anesthesia, and that you're really comfortable with it, that should obviously be your first priority to try to use that. If you can, and you have the supplies to stay with that protocol, then stay with it. If it's not putting a demand on supplies that are needed in the human healthcare, then great. But I think it's just good to be aware that you might have different demands placed on you and pressures, and then we have some alternative ideas. And always, if you're switching protocols, you're using a drug you've never used before, absolutely reach out to other veterinarians who maybe have experience with that so that you can just get some ideas and what you might need to look out for and prepare for.
One last thing we were just talking about today is we're all going to be decked out in PPE and dressed head to toe and all of this crazy stuff, how that might affect the animals, the dogs and cats coming in. So just being aware, we always want to think about general animal handling and being as fear-free as we can. So how do we take that into account as well in terms of our approach with animals? So just something to be aware of there. But I think just moving on for time purposes, one of the biggest things we're hearing is staff safety. We want to make sure everybody feels safe, everybody feels good about doing this, and because obviously we're trying to balance financial considerations, serving the public, getting all these animals done, but making sure everybody's safe too. So Natalie, you run a clinic and have had to deal with this a lot yourself right now. So tell us some things about how you're going to deal if somebody calls in sick or if they get this, or how you're going to deal with that aspect.
Yes, I think everybody is probably looking at planning for a lot more sick leave in 2020 than in previous years with the CDC guidance on, if you're not feeling well, don't come into work. Having, kind of planning your staffing around having extra relief teams to come in or cross-training your staff to fill in for each other if needed is going to be a really important strategy in kind of managing getting through all of this. There are some sort of HR things to keep in mind in terms of people calling in sick. So, if they're sick, they should stay home. If they test positive for COVID-19 or they're waiting a diagnosis of COVID-19, you're going to want them to stay home until they're cleared by a doctor to come back. If they're exposed to somebody that is a confirmed case, kind of same thing, like they can follow their doctor's recommendations, but you just want to make sure that you're really mitigating that risk for your staff, because you may, there's a risk there that if, several people on staff can contract COVID-19, you might have to close down your clinic. So you just want to be really careful. One of the things that came out in the Families First Act was the requirement for paid sick leave. And it does allow for, so the requirement is if somebody contracts COVID-19 or is caring for somebody who is, or if they are, they don't have childcare due to COVID-19 related circumstances, that employers are required to provide paid leave. And there is a provision that exempts employers with less than 50 staff, but you have to also kind of meet a certain threshold. So just be sure that you're really kind of careful about that. Just check into it. There are some links on the website in the staff safety section that you can check out from the Department of Labor. along with notifications that you do have to give your staff right now, that kind of all of those HR posters that you have to hang in the break room. There's a new one that you're going to want to make sure that you have distributed to your staff. And all of this is in effect from April 1st to December 31st. So if you have an HR professional like on your board, or you have an attorney, or somebody, or a lot of times even payroll processors will have access to experts that can help you sort of navigate all of this stuff, because it can be really tricky. If you are paying staff for COVID-related leave, you are eligible for tax relief in your payroll taxes. So it's really complicated, but there are some options for you if you do end up having to pay for sick leave. I think the only other thing that I wanted to mention about that is, let's see, we talked about the staff readiness survey and just really kind of getting a sense of their comfort level and their ability to come back to work, and if they feel that they may need to be redeployed to a position that may be a little bit, have less contact with other people, kind of keep that in mind. And as people are reporting confidential information to you, just make sure that you're not disclosing any, privacy information about your employees. You can notify clients and other employees if someone does test positive, and you should inform them, but you would not want to tell them the person's name or anything that would identify them in particular.
Great. And obviously it's harder with medical staff to be able to have them do things remotely, but with admin, there are certain things you can do. So whether it's having people answer the phones remotely and being able to forward your messages, or it's being able to do from different parts of the building or spreading them out. One good way to do it is actually, we kind of touched on this a little bit earlier, but telemedicine is a great thing that right now, so you can be having, instead of having people have to come back in for rechecks into your clinic, you could actually work to set up a telemedicine platform, or you can just use Zoom or FaceTime. But there's a great one right now called Pet Connect Pro, which is basically run by BI, and they are offering it. They do charge 5% per transaction fee, but if you offer free rechecks, then it is free for you to use. It's a video platform. I've used it. It works really well. But so instead of having your clients come back in for a recheck, they can just video chat with your tech, with your vet. You do need to make sure in terms of using this that your state allows telemedicine first. And you do need to also make sure that you have that VCPR relationship. So we do have some guidelines in there about how to look for that and make sure that you can be allowed to do it. But that's a really nice thing that you can do right now. We are also seeing a lot of clinics go to online pharmacies. So you can sign up for free for Covetrus or for VetSource. And instead of, if people need refills or additional medications, or if you do wellness and vaccine clinics, that's a great way to be able to send out things, whether it's food or medications, through there as well, and not have to have people come back in. Okay, so one of the questions I've seen a lot in the chat is, well, how's this working for all models? Like, can you please talk about mobiles, which are obviously very close quarters, or, how does this work for vaccine and wellness clinics? So I'd love to hear our panelists kind of weigh in on this. Gina, I know you've got a great model for some drive-through vaccine clinics, but I'd love to hear your guys' thoughts on how this works, since you represent different types of programs.
Yeah, related to drive-through vaccine clinics. So if your clinic has never done a drive-through vaccine clinic, it's a good time to start thinking about whether or not that's a possibility. So again, it comes down to, do you have a parking lot where you can set up maybe a station in the middle. You pre-draw up the rabies vaccines. You can do just very limited service. So rabies, dewormer, self-flea tick medications, that type of thing. So if you could do that in your parking lot, it's large enough, then that model works great. The way that I've seen it most successfully done is actually using partnering with the local fire department. So at the fire department, this was in San Benito, Texas, they actually cleared out a double bay kind of fire station, and the firemen kind of manned the parking lot management, and then the clinic was able to sort of set up in the middle and have cars on both sides. And then, so in this particular time right now, of course, staff would have to be dressed in PPE, and again, everybody stays in the vehicle, and they just roll down the window and do the shots through the window that way. So those are some options that I've seen work successfully for that specific thing.
What else? What else can you guys talk about regarding mobiles or other types of, because the goal was this can be applied to any model. I mean, that was kind of our goal as we were writing this, so that they can all be adjusted. But does anybody have any other thoughts they want to add on that?
If you are operating a mobile or a transport program, you'll want to make sure that you're checking with the communities that you're traveling to in terms of their, what's going on in their community, their regulations, and just kind of be aware of that as you're, if you're reopening your program or continuing your program, just making sure you're aware of that.
Yeah, and one of the questions that just came through was, how do you collect prepayment for a vaccine clinic? So again, my recommendation is that even though it is going to be a drive-through vaccine clinic, that you still require that participants pre-register online. So they make an appointment, so to speak, which again is super helpful if let's say the vaccine clinic goes from 9 to noon, that not everyone shows up at 9 because they think their appointment is at 11. So it helps to parse out those appointments. So again, requiring same exact thing, pre-schedule the appointments, pre-print out the paperwork, do the merge fields, and pre-prep all of their preventative medication. It can just be stapled to the thing and take payment ahead of time. There's going to have to be some adjustments made. So in terms of the payments, if people want to buy something while they're there, or you have to refund something while they're there, that those could just be done, with a wireless credit card machine or online on a computer that's set up. But again, doing everything ahead of time that you can is my key recommendation.
Gina, did you find, because you do this a lot in Native nations, so you do it in like a lot of underserved areas, and you were actually find a lot of people you originally thought maybe they're not going to have access to be able to do this ahead of time, were able to do it, right?
Yeah, we actually, I was doing this kind of check-in, check-out at the Laguna Pueblo outside of Albuquerque, and it was working super great. But we actually did a little bit of a case study at the Hopi Nation, and found that out of 100 folks, we had 100 slots for spay neuter, and out of those we had universally everyone had access to an email to be able to get their documentation and pre-make appointments, which was kind of different for that particular clinic because they had held it before, and it was just kind of a lineup. You just kind of get there in the morning and line up. But universally, we found that people were able to make appointments online 100%. And then out of those, we had about 70% of the folks were able to actually pre-sign their surgical consent forms on the Hopi Nation. And so that was electronically. So some of the most rural places in the country actually have really high participation rates of being able to access online services. So again, just making appointments online, having them pre-sign stuff, prepay.
All right. So
Gina, I'd like to ask a question that is a follow-up to that just came in. Are there liabilities or concerns associated with fearful dogs inviting owners or staff in the cars?
I am not sure. I would assume those liabilities would be the same no matter what your normal check-in process is, because a lot of times clinics have people just line up in the parking lot normally. So whatever the liabilities would be during that situation, I would say it would be the same as it would be for the cars.
And you can also take them out of the car. So they can pull up and wait in their car so that there's not long lines of people, and then have the animal be taken out of the car and done in a safe area, like a tent or in a room within, and then be brought back to the car. So there are ways to adjust that. But I do, just based on time, want to run. We have one more question before we get to the Q&A. So, and that's financial. So Natalie, if you just briefly kind of want to give some ideas for those who've been really struggling like yourself, what are some ways that they can look at to become solvent?
Yes. So I have typically been thinking about things in years and quarters and months, and now I'm having to shift to thinking about weeks and days. And we're looking at different models for our clinic, thinking like, okay, we're probably going to be open X number of days for spay neuter and X number of days for wellness. So how is that going to change our revenue? We know what our salary costs are and our fixed expenses. And so does that leave us with any sort of deficit? So there's all these kind of questions, and they all kind of, one leads into the next. So I created a spreadsheet that's available on the website that is just kind of a back of the napkin calculation tool to kind of, if you feel like you're stuck and you're not sure where to start, you can start plugging in some numbers to start looking at how your revenue might change. And probably your 2020 budget is out the window at this point, and you're having to kind of work on the fly. So if your business model relies heavily on clinic revenue, which I know a lot of us have been doing that, it's very sustainable. And at this point, it's kind of a little bit less reliable. I would really encourage you, don't be afraid to start fundraising. If you haven't done that before, utilize your social media platforms. It's really easy to get started on Facebook. So if you're worried about your clinic revenue, like definitely don't be afraid to jump into fundraising. I know we're in a financial hard time nationally, but there are still lots of people out there who want to be generous and want to support your program and want to make sure that your program survives. One of the things that we've also started doing is really ramping up our online pharmacy program. We actually were using a vendor for that, and that's super easy, and it's a great option. We decided to bring it in-house and do it ourselves with the fulfillment because we can offer lower prices and we get a little bit more of a cut out of that. So we determined that that was actually going to help us bring in a little bit more revenue. And we can also keep, return clients who are just coming in for a box of Bravecto. They don't have to come into the clinic. We can actually just mail it to them, or they can pick it up at a drop box outside or something like that. So it's going to be kind of a bumpy year. And hopefully the spreadsheet will be a little bit of help if you're not sure where to start.
So yeah, that's a very good segue. Thank you for that. So the website, so Dr. Levy has posted it, if maybe she could post it again in the chat of where this is located on the bestfriends.org website. So she'll post a direct link, but if you can't remember that link and you go to find it, if you just go in and look under the COVID-19 resource page under Spay Neuter, it will be there along with this webinar and some others. Like we said, it's going to be a living document. We're going to be updating it, changing it. We're hoping we're going to go through the chat and pick out all the good ideas you guys did. We'll be doing regular updates, and we'll be looking for more samples. I know Neighborhood Cats has put together some good samples, so we're going to be, talking to them about being able to share some of that as well. So, so definitely the goal is to have one nice place where everybody can go and get all this, because there is just so much that we all need to just share with each other, and everybody has good ideas. So, Dr. Levy, let's get to some questions. Hit us.
First, I wanted to say that we're getting a lot of questions about the logistics and the legalities for drive-through vaccine clinics, such as how do you get the exam done and all of this. And so what I would just say is that information is going to be fleshed out in detail in the Spay Neuter Preparation Guide online. So watch for that information appearing there. So now to go to the questions. Are there suggestions about how to safely monitor patients under anesthesia intra-op and social distancing as much as possible? I would say Jen or Elizabeth would be good for answering that question.
Yeah, I can start, and Jen, feel free to jump in. I think this is a good example of how there's not going to be a perfect single answer for every scenario, right? So MASH, mobile, stationary, everybody's going to have a different clinic set up. You're not going to be able to maintain 6 feet at all times. That's why we wash our hands. That's why we're wearing masks in the clinic. Our monitoring equipment may differ, but thinking about how visible it is from a distance is probably important here. I think obviously veterinarians, surgeons are almost always also keyed into monitoring anesthesia in these clinics, so that's nothing new, and we're standing right there. So I think there's an element of knowing our patients and monitoring for ourselves, communicating clearly across the space, and making sure that monitoring equipment is visible. And none of that's any different than what we've done in the past. Understanding that ideally we would have 6 feet between us, we will not be able to do that in every scenario. And so we're mitigating that by asking the questions of staff beforehand, having a positive work culture where people feel like they can communicate if they're not feeling well and not come to work and not necessarily be penalized for that. And truly, in some cases, as I've been talking to groups, those that are working in a small clinic, which is no bigger than a mobile setting, they're used to having really small teams of people that are highly efficient. And so the fewer people we have, as long as those people are healthy and feel like they can communicate and are taking the basic measures, that might be safer than a lot of people in a bigger space. And so this is my caveat to say that a lot of times when people want a protocol, I have to ask them a lot of questions before I can give them that protocol for their situation. And so every single clinic has slightly different challenges and scenarios, but what we're hoping is that we've outlined a way to think about those challenges and scenarios to at least help you think through the questions you ask and then what options may be out there and what solutions other people have come up with. And so that's my long-winded answer to a relatively short question.
All right, Natalie, I think I'll pass this one to you. Jennifer asks if it's better to work longer days less often or shorter days more often.
Mm-hmm. That is the question. Yeah, I think it kind of depends on, you know, your stamina of your staff. I think stress levels are really, really high right now for a lot of people. So I think you really need to be mindful of that. At the same time, we're all trying to balance the fact that many of us have been closed. So we have a list of cancellations, and we also have a wait list on top of that. And it's oftentimes hundreds and hundreds of appointments that we're trying to get back to. So I think, you know, I really think it depends on how your staff feels about it. And we've tried to be really collaborative with our staff in kind of making decisions about how we're going to operate. So I think it really depends.
All right, Cindy, Kate asks, what should we be doing or recommending with feral cat TNR caregivers as far as how they can safely care for their cats, and how should they bring them into clinics and cats in traps be managed during the clinic?
I feel like that could be a webinar all on its own. So I will try to be brief here in the few minutes that we have. It's similar to with all activities that we do, and it's being aware of your own health status and those of others. So again, social distancing. If you're ill, not the time to be going. Depending on your community, being aware of what you're being asked to do. So, you know, in some communities, not leaving your house without a face mask is what is recommended. Staying aware of other people around you, probably only being present one person at a time, and then just being respectful of what the clinic that you're working with, how they're choosing to prioritize patients, and being aware of the systems that they're working with. So I hope, but potentially, again, we could do a whole webinar on that, but I hope that starts to give ideas of ways we can be interacting with our cats.
Yeah, I think so, and I agree. I think that what we're hearing is we should really think of the TNR community cats just like other cats. We don't really need to modify our approach to common sense recommendations for distancing sick people from cats. And then another question, any suggestions for the veterinary medical director of a spay-neuter clinic upon reopening where non-vet director, board of directors, etc., do not want to enforce social distancing and masks for staff and clients that are mandated by their state? So this is really speaking to maybe a disconnect between the vet's view on social distancing and the management team. Who am I going to pick on? Aimee. She's a manager.
Yeah. Well, I think that's a really good point when you start to really refer to your local health department, your state health department, your local VMA, because the CDC, because they're the ones who are making the guidelines to protect people. So it's not just you coming and saying it, but you're actually hearing it from authorities. And I think that can be very helpful. But I also think having a one-on-one conversation about it and really talking through the concerns is really important, because you got to have communication between your director and your medical director. And I think that oftentimes there are a breakdown in general. If you've set up from the get-go what a good relationship is and what expectations are and what job descriptions are, that helps. But I think also really reaching out to the officials is a really, really important thing. And, you know, also explaining to them that, look, we don't want to end up having where we're going to have other issues, because, I mean, obviously there are things to protect employees here. And so we really need to make sure that we're protecting them so we don't get ourselves in trouble.
Very good. And so, Jen, this question is for you. When spay-neuter clinics reopen, should they restart at a full surgery schedule with full staffing or gradually work back to full capacity?
Yeah, great question. And you know, as we say a lot in this webinar, is it's going to depend. I think in general, most clinics that have had to close for whatever reason, they're not starting back at full capacity. It's just in order to readjust and make these adaptations that are needed to really kind of work in a new disease controlled environment, that it's going to take some time to figure out how to best make those adjustments for that particular space and for that particular staff. And a lot of that is going to require just more time per patient. And so cutting back on the capacity to begin will help ensure that things can run more smoothly as you're learning, like, okay, 6 feet means this. All of a sudden I realize we're sharing this equipment. Maybe we need a second shaver. You know, as you work through opening at a reduced capacity, it allows the team to figure out and highlight some of the challenges that they're realizing in how to work within a new kind of style of practicing spay neuter. So I would say for most, it's going to be reopening at a reduced capacity, and it will just depend again on the team size, physical space, but allowing that time and that reduction to give the staff the ability to think creatively and to recognize the changes they're going to need to make is really helpful, and it will be the best thing for the patient safety. Because if we try to go back at full capacity and we're unprepared for how difficult this might be, then what could be a really negative outcome is patient safety. And so we always need to keep that in mind too.
Before everybody drops off, I would say this would be a great time. There's been several questions in the chat asking where people are with this, with their own clinics. Are you closed down? Are you partially open? Are you fully open, or are you like in the process of opening? So if everybody could just sort of chat in your current status and where you think you're going over the next few weeks, that would be really interesting. But then, EB, I'm going to ask a question to you about fomites. There's been multiple questions about whether traps and carriers could serve as fomites, and if so, how to mitigate that risk. And then also a lot of interest in whether the fur of pets can be a fomite.
Mm-hmm. Sure. And I think this is one of the areas where we have learned quite a bit in the last 3 to 4 weeks as science has had a little bit of time to catch up. So early on, we were worried about the fur as a fomite. For all intents and purposes at this point, that does not seem to be something that we need to worry about in any large scale basis. The CDC feels pretty comfortable that fur as a fiber is not really a high point of concern for the average pet coming into our clinics from a healthy household, keeping in mind that we are using those screening methods. Certainly there are other things. So plastic is a concern for fomite transmission. And so in the guidelines, we did account for wiping down cat carriers and that sort of thing. We did account for trying to switch out leashes. Again, none of this can be done 100% of the time. This is all about mitigation. It's not about completely eliminating risk. And that's why we have all the layers. So wiping down cat carriers is a good idea. Traps are trickier. They're really hard. You can't really wipe down a trap very efficiently. And so we've got to think about how we sort of mitigate that. The surfaces of traps are certainly less of a concern. And so I think our normal kind of process of throwing a towel over a carrier, maybe we switch that towel at the point of handoff or something along those lines. It all depends on what your protocol is for that handoff. But I think there's ways to kind of put covers over traps, like switch our covers, move them in. Again, there's not a lot of surface there. It's all wire. We are wearing masks. We are washing our hands. We are using hand sanitizer, all of those other things. And then paper we talked about. And so we do have some recommendations in there in terms of managing the paper for that short window of time when it may be a risk. I think all of us have learned a lot in terms of becoming more sensitive to our own behaviors to try and minimize risk. And as part of a team, we're going to be sensitive to our colleagues and helping them minimize risk. It's really hard to forget to touch your face, right? I've probably touched my face 3 times during this webinar. Luckily, I'm in my own home. But I think there is an element of remembering that we are always mitigating, that we take the precautions that we can, and that we help protect the people around us, encourage them to take the precautions. One of the other things we have in the packet is a checklist for the morning for surgical teams, and this kind of comes out of the Atil Gawande, the checklist manifesto. This idea of checking in with your team each day, reminding them of what the challenges may be, the things that we need to keep in mind, and then, of course, how to keep themselves safe. And so there's an element, too, of this being a consistent, constant process in what we do, and just part of our new habit during this time period.
That's great. Checklist Manifesto is one of my very favorite books, should be required reading for everyone. I'm going to ask the next question, maybe pitch it to one of the managers. There's been several questions about how we should screen staff and the public for possible exposure to COVID. And, you know, there's all kinds of HIPAA issues involved, and it may vary even state by state. I know at the University of Florida, our clinic is still open for emergencies, and they do have a script that they read about whether people have been exposed to someone with COVID or if they've been diagnosed themselves. And I'm sure our university lawyers have vetted that. But so can the managers tell us about what is appropriate for screening the public, and then what is appropriate for screening our staff?
Well, I saw a comment earlier from Dr. Getz. I think it might vary state by state, so you really do need to check with some of your state and local, regulations. Here, I'm in Tennessee, so we had an HR attorney advise us to send a memo, an email to all the staff, requiring them to report to us if they test positive or if they've been in contact with somebody who tests positive. We can take temperatures on the way in if we need to, if we decide to do that in Tennessee. But I do think you kind of have to be really careful and just check. It looks like in Arizona that you might not be able to require it, but you could maybe ask them to do it, but you might not be able to bar them from working if they decline to do it.
And then this is a combination question about confined spaces, I guess. And so we'll see who feels like this is the best one they can answer. Any suggestions or considerations that need to be addressed prior to restarting spay-neuter transport programs for client-owned animals? And then Sandy asked to please talk about mobile clinics.
When I saw a lot of questions coming through about mobile clinics, and I think it's going to be really challenging to mitigate the risks on a mobile clinic. I think we know even in a brick and mortar, quote unquote, building, we're going to still struggle to keep 6 feet of distance. And in a lot of cases, we won't be able to do that all the time. So kind of like Dr. Berliner said earlier, it's the layers of, trying to do different things, but we know we're not going to completely remove all the risks. So I think the first question you really have to ask yourself is now the right time to open? And then when you feel like it's safe enough to open, then you have all of your, like the OSHA guidance is your engineering controls, then your administrative controls, then your PPE. So PPE is really not going to be your number one priority in keeping staff safe. It's really those other things first, and PPE is kind of like at the bottom of the list.
I think putting together a checklist too that actually has like, what are all the things we need to think about? So, are we going to need to make face masks for our staff? Are we going to need to find face shields? Are we going to need to put up plexiglass in between a prep area? Are we going to move, instead of having a large recovery beach, are we going to move it into small areas? So I think almost doing like a dry run of like, what are all the things we're going to need to do? What signage am I going to need, and where does it need to go? Putting together your little checklist of everything you're going to need to think about, and then really starting to parcel that out to everybody to work on will really help, so that when you get there, it's like, oh, okay, we've thought about that already. And I think that would really help.
I'd just like to add on to previous comments before, and I think one of the ways that I've been thinking about spay-neuter, and this goes back to, this feeling that it's considered not essential for this time period, and kind of the pressure that I think a lot of places are feeling to get back to spay-neuter, and that it may not be, it's making a lot of people uncomfortable in certain areas. And so one of the things I really started to realize is just how thankful and appreciative I am for the spay-neuter efforts that have been going on for the past decade and what we have accomplished. And I've really started to be aware that we have been able to navigate through a human global pandemic without a significant or, pet overpopulation boom in a month, or, packs of dogs running around, and, in most areas across the United States. We have been able to navigate through this because we've had spay neuter and because of what we've been doing in this work for so many years. And I just think we all need to celebrate that and just pat ourselves on the back for that and celebrate our colleagues in this, and that, this effort has really helped us to be able to navigate through this really challenging human disease time. And that if you're feeling pressure around this, to just look at your community and say, gosh, you know what? We have more capacity in our community than we thought for fostering animals. We're seeing that in shelters. We have been able to be on hold for a month, maybe 2, some places maybe 6 months. There's going to be communities that can be on hold because of what's been happening for the last decade in spay neuter. So I don't want us to forget that. I want us to really celebrate that. And then I think for those organizations that, you're feeling this pressure because, gosh, we need to pay our bills. What are we going to do about our staff? I think highlighting that story, highlighting what that group has been doing for so many years and how it has enabled us to think about our human colleagues, to protect our staff, to protect our friends and family during this time is really important. And I think there can be a lot of fundraising opportunities around this. I'm going to put a selfish plug into the funders out there to really help support the organizations that have had to stop for this period of time. And let's figure out how we can keep them around so that when things are safe again in those communities that are really challenged, then we can continue this long road plan. We know spay neuter is not, only a 6-month thing. This is multi-years. It's a long range plan that we need to keep doing for just humane pet population management.
Well, I love that. And I think we do need to celebrate. So virtual high five, Dr. Bolser. And I think that we never had, there was no high volume spay neuter how many years ago? I mean, people thought it was not possible to be able to safely fix this amount of animals at one time. And now it's the norm across the country. So I think that this is going to be an opportunity for us, and we have to think positive because it's easy to go into a negative. This is a time when we can reimagine spay neuter. What can we do virtually? How can we get better so we don't have long lines of people waiting all the time? What can we change in this to actually make it better so that we can fix more animals? It might look very different than it does now, but that's what we're good at because spay neuter people focus on prevention. We focus on the root of the problem and solving problems. So we're perfect. We're made for this. So I'm with you.
I'm really excited about how the nationals are pulling together and joining in to answer Jen's call about helping us fund this recovery. So with that, I think I'll turn it back to Aimee for some closing comments.
Yeah, well, I think Kim posted in there, we are all rock stars. So yeah, I think that's a good way to end. So please check out the guide online. Please do send us your samples. And if you have any questions, you can also send it in on that sheet. We're happy to answer stuff as well because this is just going to be an evolving process. So thank you very much for joining us. As soon as we do say goodbye, this cuts out right away. But thank you very much. We really appreciate your time.